Hello everyone, welcome back to my channel Muskan Psychology Network. Today we will be studying about dialectical behavior therapy. Now this is your reference and for your exam, Mphil clinical psychology entrance exam or your UGC Net exam, the most important question they ask is what is DBT used for? Now, it is used for the treatment of borderline personality disorder, or the question can be vice versa, that what is the best treatment for borderline personality disorder? And that is your DBT or dialectical behavior therapy. It was created by Marsha Linehan's effort. Now, this is the only information you need to know for your exams. But if you want to dig deeper into dialectical behavior therapy and know more about it, then you can keep going. I've created a very heavy loaded PPT for you guys so that you get all the information from here and you don't have to go on looking and searching for other places. Now, there are five functions of the treatment. The first is enhancing capabilities. So if you see in BPD, you see that people have a distorted self-image, they have unstable relationships because they might get reactive, feelings of emptiness, and there can be a lot of comorbid disorders of depression and anxiety, and they are very impulsive. So one thing which we have to teach them is that they have capabilities, but we have to enhance them, and those involve regulating emotions, paying attention to the experiences of the present moment, and regulating your attention, which is your mindfulness skills. Then, effectively navigating interpersonal situations. So, when they have those reactions in relationships, how they can navigate through those reactions is something they have to learn, and tolerate distress and surviving crisis without making situations worse. Now, tolerating distress, whenever they're distressed they might have impulsive thoughts and actions. So that area that they can tolerate their distress and survive the crisis which is happening either in their thought or affective level, that they can tolerate, that has to be taught. So this was your function number one, which is enhancing capabilities. Coming to function number two, which is generalizing capabilities. Now, what are they saying? That the skills learned in therapy sessions do not transfer to patients' daily life, then it would be difficult to say that therapy was successful. In the therapy sessions, if your client says that he or she has learned what he is supposed to be learning in therapy, but is not able to transfer it to their daily life, then basically therapy sessions were quite futile or even pointless to be said. So, the things, the behaviors, whatever he's learning in the therapy has to translate into their daily lives to actually make sense, actually improve their life. Moving on to function number three, which is improving motivation and reducing dysfunctional behaviors. Now, what are the dysfunctional behaviors? Uh, Again, coming here, dysfunctional behaviors can be again at the affective level or at the thought level or at the behavioral level. So it can be the fear of abandonment, impulsiveness, self injury, risky behaviors of drinking and smoking, feelings of emptiness, so and suicidal threats. So these are coming from dysfunctional behaviors, and we have to reduce those. So what can be done that whenever such clients have such kind of thought, they can write it down in a diary card, which is which would eventually help them to self monitor. So this is your function number three. Coming to function number four, that is enhancing and maintaining the therapist capabilities and motivation. Now this is not something which we would be doing to the client or to the patient, but to the therapist itself. What happens that, see, DBT or any kind of personality issues, these are quite challenging issues for the therapist itself, because personality issues are in your trait, and to change something at the trait level, it's very difficult. So what happens, these can exhaust the therapist itself and become challenging, but What can help is that if they get support, validation, training from better therapists, essentially, they can learn to cope up from such exhaustion from the patients. Coming to function number 5, which is structuring the environment. Now, DBT involves structuring the environment in a manner that reinforces the effective behavior which they are learning. So, in the therapy, they are learning some behaviors, and the environment has to be such that they are reinforcing it. So these were all your functions. Now let's get into the biosocial theory and emphasizing emotions in treatment. So what is biosocial theory saying? The biosocial theory is essentially saying that BPD, the people with BPD are born with a biologically hardwired temperament. What is temperament? There are like 7 temperament dimensions like reactivity, self regulation, etc., etc. So on such temperament levels, there is a disposition towards emotional vulnerability. Now, emotional vulnerability consists of a relatively low threshold of responding to emotional stimuli. Like, suppose they had a fight with their parents. Now, they are threatening that they would do some kind of self injury. Now, you have to keep in mind that all kind of self injuries patients or individuals do not have BPD, but people who have BPD, again, not all of them, but some of them can be reactive in the manner that they can do self harm, they go into binge drinking and smoking. So these are your emotional vulnerability characteristics, that there are intense emotional responses. Nothing is on a so-called normal level, so-called what other people would do. It's always heightened. So, and it becomes very difficult for them to return to the baseline level of the emotional arousal. So biosocial theory says that, of course, now, of course, if the parents do not give them proper environment to learn to cope with such emotional reactions, as an adult it would be difficult, but there is also a biological element to it. So DBT, which is dialectical behavior therapy, essentially created for BPD patients, is an emotion focused treatment. Now this is something which you can take a screenshot and read it out. This is basically essential skills for a therapist. Next, if we talk about the dialectical philosophy in DBT, what is unique in comparison to the everyday CBT treatments is that it has existed thousands of years first, and the dialectical philosophy is wanting to balance the opposing forces like change and acceptance. Like, the patients need to realize whatever high intensity surrounding they have or stimuli which is getting created, they have to accept it, but they have to also change their behaviors, how they react in the present moment. They have to change those. A lot of influence of mindfulness is also there in DBT, and therapists have to keep something in mind, that they do not have to be right, but they have to collaborate with the patients in such a way that they can change some of their behaviors which are not serving them, and in that process also accept few surrounding situations. Now it's not saying that if something bad or wrong is happening that they have to accept it, but they have to accept certain things as it is. Coming to acceptance and mindfulness in DBT, like I explained, that they have to have some kind of acceptance of their present and of their reality to better cope with their environment. Like I explained about distance tolerance, which is that in the moment, if they're feeling a lot of distress, how by enhancing few capabilities they can tolerate it. Another acceptance intervention in DBT is called radical acceptance, where the patient is experiencing the present moment for what it is, be it bad, be it good. They are experiencing it for what it is without struggling to change it or resist in some kind. So, and this is greatly helped by the mindfulness practice. So, this was all about DBT. Thank you so much for listening. And if you learned something, then please do like and subscribe to the channel.